Are you dealing with some shoulder injury? In this video, we're going to go over the shoulder 101. So we're going to go over the anatomy, we're going to go over the injuries, and the potential root of your injuries. So my name is Dr. Marco Lopez, Doctor of Physical Therapy and Certified Strength and Conditioning Specialist, and co-founder of the Basketball Doctors. So let's just jump into shoulder anatomy 101. The shoulder is a very flexible and mobile joint. So we're going to talk about what's composed of the shoulder first. And there's a couple joints within the shoulder. So with the shoulder, there's a couple things, like what is it? So we have the humerus bone here, we have the clavicle bone here, and we also have the shoulder blade here. Those are the three main things that compose the shoulder, and then there's other joints within it. So within the other joints, so within those three things are going to create the joints that we have. The joints, we have the glenohumeral joint, which is the joint between this humerus and here, and the shoulder blade. We also have the AC joint, which is the clavicle bone here and the shoulder blade. We also have the scapulothoracic joint here, which is the joint between your shoulder blade and your rib cage. And then we also have the sternoclavicular joint. But all these joints allow the shoulder to be mobile and allow it to move the way we want it to move. So those are the main joints of the shoulder itself. We're gonna go over the movements within the joints. So the mobility aspect, like I said, because it's like a ball and socket here, as you can see here, here's a ball, here's a socket, it's very mobile. Let's just talk about the mobility just at the glenohumeral joint. Remember, there's four joints: the sternoclavicular, the AC joint, the scapulothoracic, and the glenohumeral. Just at the glenohumeral, we have a couple movements here. So we have flexion, whenever you raise your arm; extension, when you go back, bring your arm back; we have adduction, when we bring our arm towards our body; we have adduction, when we bring our arm outside our body; we also have external rotation, when we move our arm this way, keeping our elbow in where we rotate; and then inward rotation, elbow in, and we rotate our arm this way. So we have all these mobile movements because of this ball and socket. That's why your shoulder mobility is huge, and we'll talk about that in future videos. Then if we look at the other joint, the big one that does a lot of movement, we have here in the scapulothoracic joint a couple movements that are huge to allow these movements, especially raising your arm over your head. And this is key, guys, too, whenever you are trying to jump higher per se. If you improve your shoulder mobility, you'll be able to reach higher, and that's gonna act like you're jumping higher. But we'll go over that later. But here in the scapulothoracic joint, we have elevation, when this shoulder blade moves up; we have depression, when it moves down; we also have protraction, when the shoulder blade moves out over here; and then retraction, when you bring, whenever someone tells you squeeze your shoulder blades, that's a retraction. We also have upward rotation. So when we have upward rotation, whenever we raise our arm overhead, this shoulder blade has to move with it, or else we won't be able to move that ball and socket as great as we can. And we also have downward rotation, when the shoulder blades goes down, and that's when they tell you bring your shoulder blades down and back, because that goes more into the downward rotation. So you can't have downward rotation, meaning the shoulder blade can't be down and back and you raise up your arm, because you'll get stuck, because this has to work in synchrony. The shoulder joint here, the glenohumeral and the scapulothoracic, and all these other four have to all work together. So when you raise your arm, go into flexion, this shoulder blade has to move upward as well. When you bring your arm down, this has to go into that downward rotation. So to recap, with the shoulder joint, we have flexion, extension, we have adduction, abduction, external rotation, internal rotation. The shoulder blade, we have elevation, depression, protraction, retraction, upward rotation, downward rotation. So those are the main mobility aspects of the shoulder joint there. Now we're gonna go into the muscles, specifically the rotator cuff muscle, because those are the ones that you most commonly see people injure, tear. Kobe Bryant had that rotator cuff tear. A lot of people end up having rotator cuff issues, but there's four rotator cuff muscles, and their main responsibility is to keep that ball in the socket, okay? So if you injure, let's say, any of those rotator cuffs, you gotta make sure the other ones are strong enough to keep everything integrated there. But we have several ones. So we have the subscapularis, which is the internal rotator. It's more in the inside part here. Then we have the supraspinatus, which is our rotator cuff muscle that goes through here. And on the back side, we have the infraspinatus and the teres minor. And these four rotator cuff muscles, like I mentioned, keep the integrity of the ball in the socket. They help keep the ball in the socket alongside with the labrum. We have a similar concept more in the shoulder blade. When it comes to the shoulder blade, we want muscles around the shoulder blade to kind of keep the integrity of the shoulder blade in place. So I'm not going to go over all of them, but I'm going to go over some main ones. Whenever you look at your back, we have the upper, middle, lower traps. We also have the lats that also do some shoulder blade issues. We also have the levator scapular, other little, the rhomboids as well, other muscles that the whole goal is to help with those movements that we talked about for downward rotation, upward rotation, retraction, protraction. These are all muscles around the shoulder blade that help guide the movement there. All right guys, now we're gonna talk about injuries. So we're just gonna go over the 3 most common injuries for basketball players. So we talked about the muscular system here. We have the rotator cuff and the scapular stabilizers. When it comes to rotator cuff injuries, those are the ones that a lot of people are scared of, and you'll see a lot of people having, like Kobe Bryant, like I mentioned before, had that rotator cuff tear. So we have those 4 rotator cuff muscles. A lot of the times people have tendonitis, overused, they're overusing that rotator cuff, or they have a rotator cuff tear from a traumatic injury. Your arm was caught in a certain position, you try to lift it and it caused that tear. So we have those rotator cuffs. So we could break them up into a tear, full-on tear, a tendonitis, another one, tendonitis. So sometimes overuse. Sometimes when you overuse it, let's say you decide to start shooting 1,000 shots in the next week and you've only shot like 50 shots before, that might lead to some rotator cuff tendonitis. Another one is a rotator cuff tendinopathy. That's overworked. Let's say you started doing 1,000, you go 1,500, 2,000 shots, 3,000 shots. You just overwork your shoulder, and the rotator cuff, like I mentioned, keeps the ball in the socket. So when you overuse it, you might have that tendinopathy. So think about the same thing as jumper's knee. If you shoot too much, too fast, too soon, you might have some rotator cuff issues. The second one is more of a traumatic injury. We're talking about the shoulder subluxation. A lot of the times, I'm gonna try to swipe the ball is going up, my arm, I don't have enough strength, and the thing gets overpowered, my shoulder sublux. Or if I land with my arm outstretched, or I try to put my arm between a screen and my shoulder moves in a certain position. It's whenever we get in a certain position where we have forces, and sometimes what happens is the shoulder sublux. And with these shoulder subluxations, what we have to worry about is making sure we didn't have a significant injury to the labrum, which is the kind of like the meniscus of the shoulder here. So it's that cushion here in the socket. And another thing, sometimes hopefully we don't have any like reoccurring subluxation. So whenever you have a shoulder subluxation, make sure you're really strengthening the shoulder. We actually have a great shoulder rehab program. Click the link below in our description. It's really gonna help get you from the basics of getting your shoulders stronger, getting all the scapular thoracic muscles stronger. But whenever you have the subluxations, make sure you get your shoulders stronger, or else you'll have those reoccurring subluxations. Another one that I'll classify within the shoulder subluxation is the AC joint. A lot of the time, sometimes you land on your shoulder, you're going up for a dunk, or someone lands on it, and your AC joint gets sprained. And what happens is sometimes you'll see this bone kind of stick out on people, and that's because they had that AC joint separation. From the NBA most recent playoffs, Max Kleber had that injury. A lot of times you don't need surgery, most of the times you don't. It's just gonna look, you could have surgery for cosmetic purposes, but the clavicle bone goes a little higher. So the first one, rotator cuff injury. Second one, shoulder subluxation, AC joint separations. The third one, and this is the shoulder impingement, guys. So a lot of people have trouble whenever they're raising their arm, trying to go up for a block, or when they're shooting. So what happens is this joint here, as I'm raising my arm overhead, there's this little roof here. As you can see, there is space for your arm to go up and over, because your glenohumeral joint, your humerus, will go down and back and raise your arm over. Sometimes though, there's different issues. One, there could be muscular issues, there could be joint issues, but you know how I mentioned this shoulder blade has to move with this glenohumeral joint? When there's an impairment there, whenever I'm raising my arm, there might be some pinching here, like the ball here hitting the roof here. And so whenever it hits the roof, you'll have that pinching sensation or that pain when you reach your arm overhead. And there's some impairments in your movement here from either the shoulder blade or the actual bone itself, through this joint here itself. So there's several different factors for that. But the main thing is my system, whenever I raise my arm, is pinching here as I'm raising my arm overhead. And that's more that impingement syndrome. So to recap, we have the rotator cuff injuries, we have the ligamentous injuries where we have the shoulder subluxation, AC joint, and then we have the impingement syndrome, which is the most common one there. All right, hopefully you guys learned a lot about the shoulder. If you guys have any questions about shoulder injuries, or if you guys need help with your shoulder injury, just comment below. We'll try to answer as many questions as you can. If you want to do some rehab with us online, send us a message on our website, or if you're local in Los Angeles, send us a message. We work here in Los Angeles, California. In regards to the shoulder, we also have a shoulder rehab program. Click the description below. But hopefully you guys like this video. Hit the like button, share this with friends and family, subscribe to our channel. We are the Basketball Doctors. Let's ball for life.